Good morning. I'm Dr. Ashok Mohanty. I want to speak to you about how you can handle your cases in your clinic through mind symptoms. Actually, why I choose mind symptoms, because when you approach the patient through his mind symptoms, the uniqueness of the case is that uniqueness of this system is that the cure rate is very high, and second one, the patient will feel well-being first, and day by day his physical conditions, the pathological conditions will improve. So how and why we have to approach the case through mind symptoms? In mind symptoms, actually the basic thing is that if you go back to our history of homeopathy, almost all our masters like Hahnemann, Kent, Haring, and the later masters like Vitolkas and others, and in India Dr. Sehgal, Dr. Pasquero from Argentina, and Dr. Candizabe, they have all emphasized on the mind symptoms, because through mind it is very difficult to understand the exact feeling of the individual, because physicals and pathological, they are the outward symptom of the person, but inside of how the patient feels during sickness, it can be observed from the mind. So through mind, when you approach a case, when a patient comes to our clinic, the first thing is that, as Hahnemann said, that the first thing during case taking is, as a physician, you should be unprejudiced observer. So there are two words involved in this. One is unprejudiced, another is observer. Unprejudiced means nothing should be in your mind during case taking. Like you are a homeopath, like you know mind, like you know physicals, like you know miasms, like you know modalities, you know thermals. No. So before, when you are approaching a case, you are just a layman, a human being knowing nothing about homeopathy. Anything that you know will prejudice yourself and focus your total case taking. It will guide you through that trap. And second thing, that when you observe, what is observation? Observation is keenly, actually just looking into the patient and exactly marking what the patient is doing in front of you. And unprejudiced observer means nothing inside you, what is to be observed, how is to be observed. Just be a normal individual, be a human being, and look into the patient. And second part of the case taking is listening. Listening is just not hearing the conversation what the patient is telling you, or hearing the talk, anything what the patient is. No, listening is actually feeling what he is saying. Like we are listening a song. Even you are not listening to the full song, even a single stanza of the song will actually guide you to the exactly condition of the total feel of the song. So listening is actually, by listening, actually we are feeling the patient. And when we do observation and listening keenly, then we go back to the language of the repertory and our materia medica. They will guide you, the rubrics in the repertory, especially in the mind section of the repertory, they will guide you to the inner core of the patient. So all these things can be obtained afterwards. This observation and listening you have to do first. Then after that, you have to go back to our repertory and materia medica to finalize the remedy. So this is a continuous process. It is not very easy. But see, when we see acute cases as well as chronic cases, when you see the efficacy of the remedy selected through mind, it is really wonderful. Let me just tell you some points about some remedies. Actually, they are the core of those remedies. We should not be prejudiced, but at the same time we have to know actually these remedies behave in this way in the clinic. Let me start with aconite. See, when an aconite patient, if you go back to our classical conditions when you studied in our college, aconite was known as eknite. Eknite in the sense sudden onset, sudden exposure to chilly, cold, airy wind results in aconite conditions. It means that whenever a person is exposed to the conditions, suddenly if he falls sick, and after one day the condition changes. When I was doing in physicals, if the patient is coming after 4 days of exposure to cold, then I will never think of aconite. But this is totally different. Even Hahnemann has told, even if there is exposure to chilly, airy, cold wind, but the patient is not showing any symptom of anxiety, restlessness, then aconite is not indicated. So aconite, the conditions of aconite is that extreme anxiety and restlessness. Why? Why it is so? Because aconite feels the disease wherein he is will take him to the condition of death-like situation. That means the disease will finish him. Even he foresees it. We have rubrics like death presentiment of, predicts the time of death. So during the state of death, see, aconite feels that yes, he is going to die. The disease will finish him. Death is not actually die, it is also a state of finishing. And so in this condition, aconite will, the need of aconite is that he wants somebody to carry him. And not carry him just like that. Carry him in a very, very affectionate manner. So we have a rubric, carried desire to be encouraged. He wants, what is the meaning of carry? Carry means the patient wants that the doctor or somebody else who is close should actually take him from the state of illness or sickness or disease to the state of ease, health. So aconite, because of the suddenness, because of the extreme anxiety, because of the feeling that he is in a condition of death, he wants that somebody should help him to take him out of this death-like problem to a very good condition, that is light desire for. So if you have taken a carried desire to be carried and caressed and a light desire for, we have only developed with one remedy, that is aconite. And what is the feeling of aconite? During sickness, aconite feels that the disease is really so serious that any time anything can happen to him, to the level of death. So he really actually frightens with the disease. But if you just caress aconite, if you just give light to the aconite patient, then he feels that he can now handle the disease. That is, we have a rubric, delusion, sheep driving. Sheep is actually a meek animal which can be driven easily. So after getting light, after getting caressing, aconite feels that disease is like a sheep, like a meek animal. Now she can, I can drive it. And if you take other two remedies in this rubric, carried desire to be caressed, the most usable remedy is pulsatilla. Pulsatilla also, everybody knows that pulsatilla also always wants to be carried and caressed, because when we are studying in the college, what we have been taught, that pulsatilla is very, very soft. We have a rubric, carried desire to be slowly. And what is the meaning of slowly? Slowly means very affectionately, with love. There should not be a jerk. Generally, people tell that my daughter, she is very, very affectionate. Even if she does something wrong, if you just look into her eyes and just admonish, she will really start sobbing. It is so soft with pulsatilla. But at the same time, we have to understand why pulsatilla needs caressing. Because during sickness, pulsatilla feels the condition are adverse to the, actually it is not mother-like. What pulsatilla wants, that everything, every disease, even if during disease also, all the conditions should be like mother. Actually, what is mother? Mother really obeys the child. Whatever the child tells, mother obeys without any contradiction. Father contradicts, but mother doesn't contradict. So pulsatilla wants a condition of motherly. So he always clings to the mother. And whenever there is a jerk, he falls sick. So he wants always to be carried and caressed with lot of affection, with lot of slowness. धीरे धीरे आराम से. Patient will tell Doctor Saab, give me such medicine that there should not be any aggravation, because I cannot handle aggravation. Actually, it really troubles me. You take as much time you want, but at least through your medicine, there should not be any aggravation. This is pulsatilla. And Criojot is totally different. In Criojot, we have a rubric defiant and obstinate. The Criojot child is so defiant, so obstinate, that he doesn't know actually this defiance is actually spoiling me. See, if you just like you tell a pulsatilla child that you have failed in your exam, I'll just admonish him. So he will start sobbing. But instead of sobbing, the Criojot child will look into your eyes and will defy. What can you do? क्या कर लेंगे आप? मेरे कुछ आया नहीं तो क्या कर लेंगे आप? He will contradict. And if you admonish, even sometimes the Criojot child will behave in that way that you will feel like to beat him. And if you beat him once, he will tell yes, और एक मारो. और एक मारो. He will not fear you. There will not be any frightening conditions. Like pulsatilla will break down. He will cry. Even pulsatilla starts doing flattering also, so that the situation becomes normal. See, he cannot handle any jerk. But in Criojot, he can handle it. He will do totally contrary things. So slowly, in the caressing, then Criojot, there is a peculiar thing in Criojot. If you beat a Criojot patient, you have to caress him. Even if your wife caresses, no, you will not agree. That is the peculiarity of Criojot. उसी को जो उसको नाराज करता है, तो वही उसको मनाना पड़ेगा. So these three remedies, if you go by the one rubric, you can differentiate these three. It is very easy how they want to be caressed and why they want to be caressed.